Welcome to the Dementia Doctor. Today we have Dr. Surya Deva here with us from Stanford, and she's going to share her amazing research in Alzheimer's disease. Welcome, and can you please also introduce yourself to our audience?
Yeah, thank you for having me. So I'm Dr. Vidyani Surya Deva. I'm an instructor in the School of Medicine at Stanford. So among some of the research projects that I do, one of it is elucidating the crosstalk between the brain and bone during Alzheimer's disease, because we have found that there preclinical changes, bone changes happening in these preclinical models of Alzheimer's disease even before the onset of amyloid pathology. And we are further investigating to see if we see these bone biomarkers in the plasma of Alzheimer's disease patients, as well as we're also using imaging approaches to kind of see if we detect any of these bone changes early on in these patients. Even cognitively normal individuals who are amyloid positive, if we are seeing any bone changes, so then bone could be an early biomarker for Alzheimer's disease.
So you're looking at bone health to see if you can predict Alzheimer's changes, is that correct?
So it's been reported that people with Alzheimer's have a higher incidence for falls and fractures, and also the other way around, that people with falls and fractures have a higher cognitive decline. So we're trying to find out which comes first, and maybe the hypothesis is that if we tackle bone health, we could even prevent cognitive decline.
And how are you tracking people's bone health? Is it X-rays? Is it the DEXA scan? Or what?
There's some studies which have done DEXA scans, but in the future we are planning to do some DEXA and also HR-pQCT to obtain the detailed bone microarchitecture in these AD patients.
And for our listeners and also for myself, can you explain a little bit more what is a DEXA scan and what is the HR-pQCT scan?
So DEXA scan measures the bone mineral density, whereas the HR-qPCT measures the detailed bone microarchitecture. And in general, I'm also looking into lifestyle interventions to prevent dementia.
So I understand that DEXA is looking at how dense and how strong our bones are, and a lot of females, especially after menopause, with having low estrogen, will have low bone density and strength, and that's how they will have fractures. Really interesting to hear about the other study that you're describing, where we look at bone architecture. What exactly is that?
So in the female peasant mouse model, we observed that the reduction in the cortical bone as well as trabecular bone, and sometimes in the peasant model it's only female specific. So there are huge sex differences when we look at the different Alzheimer's models, whereas in the MAPT and the FTD models we saw changes in the cortical structure, trabecular structure, both in the males and the females.
Oh, okay.
And sometimes the biomechanical properties are altered, depends on which preclinical model we are studying.
Oh, okay, understood. So you're saying that for your mouse models of different diseases, including Alzheimer's and frontotemporal, you're seeing differences in bone structure for individuals, female mouse with Alzheimer's as compared to male mouse. Is that correct?
In the peasant mice, yes.
Yes. Oh, in the with the Alzheimer's model mouse that we have, one of the mouse model is called as peasant. It's one of the mutations, and you're noticing that difference in bone structure from male to female. Only for Alzheimer's disease mouse model, not so much for frontotemporal dementia. So that's interesting. Are you seeing that the female mice are having a weaker bone structure, or what exactly are you seeing?
So we're seeing reduction in bone mineral density and as well as reduction in the bone structure, like cortical properties and trabecular properties.
Okay, and what do you mean by trabecular properties?
So trabecular bone is, when we're looking at the femur, it's the bone right after the growth plate, whereas the cortical bone is at the middle of the femur.
Okay.
So that's where we look at the bone properties.
Okay, and does that correlate with having fractures when you have fall? Which one, the cortical or the trabecular, which one?
I think both have a role to play in that.
In having fractures if you have a fall. Okay. So what are the most interesting findings in your research that you wanted to share with our listeners?
So we also found increase in the follicle stimulating hormone levels in the blood in these patients. So follicle stimulating hormone is one molecule that actually has a dual role. So it contributes to brain atrophy as well as it contributes to bone loss. So the goal with our study is to find such therapeutic targets which have a dual mechanism wherein we can target both the comorbidities at once.
Oh, so you're saying that the follicle stimulating hormone itself, if we have higher amount of that hormone, we can have shrinkage in our brain and also
Yes.
lower bone density? I did not know that. Okay, that's really interesting. So is your lab also looking into therapies to help lower that hormone?
We are working on identifying more common therapeutic targets that we can target. So we're in the process of discovery. So we're doing some proteomic analysis for bone markers and senescence markers. So we look at the plasma proteomics from MCI patients, AD patients, and even there we see sex-specific differences.
Oh, okay, okay. So, yes, I mean, again, for our listeners, MCI is mild cognitive issues and AD is Alzheimer's disease. So, you're looking at biomarkers from the bone health as well as blood and seeing how they're different from these different individuals who have either mild cognitive issues or Alzheimer's disease, and seeing how they are different and kind of trying to then understand what would be the best therapy. Is that correct?
Yeah.
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 Okay. Okay. Anything else that you would like to share with our listeners today?
I think the main initiative that we are doing is how do we prevent dementia, because there could be a lot of drugs that are under researched, underway, but the best solution any day is to prevent it from happening in the first place. So it's a finger project that had been launched in Sweden and across 40 other countries. Now in India, we're trying to develop region-specific interventions to prevent dementia. And as most of you know, India is such a diverse country, and every few miles we go, the food is different, the language is different, the cultural atmosphere is different. So these 5 interventions that include diet, physical activity, cognitive exercises, sleep, and cardiometabolic health, and social interactions are anyways embedded into our cultural. So we are trying to kind of develop for each particular state different food, different dietary aspects, different cognitive exercises, which could even include the complex art forms that we have, Bharatanatyam, Kuchipudi, Bhangra, or even the musical instruments which are cognitively stimulating, because sometimes some of these dance forms need eye, mind, and body coordination all at the same time. So we're trying to really hone into the cultural aspects that we have and integrate into these our lifestyles so that we can all head towards a dementia-free society, hopefully.
That's one of the most heartwarming things that I'm hearing today, and that's exactly what I tell my families, especially when they ask me what kind of brain health exercises should I do? Should I pay for an app or should I buy something? And I always tell them, do something that is stimulating. It could be as simple as gardening. I mean, even gardening is very complex, and here you're talking about so many very, very complex dance forms that we have in different states. So thinking an approach where you attack different kinds of things at the same time. So, as a complex dance form, it involves physical activity, it involves mental activity and coordination, and of course, you're socializing when you're dancing. So that's something that is very positive, that the fingers trial that was done in Sweden, and then we had was it in Finland? Was it?
Yeah, it started in Finland and now it's spread across many other countries, but we are trying to develop region-specific interventions, taking the best parts of what we have.
And very recently at the other major Alzheimer's conference we had the results of US Pointer trial, which is very similar to what we're talking. We are saying that there are so many lifestyle changes that you can do to help prevent dementia or reduce the risk of cognitive issues. And these, of course, because they're lifestyle, they are very specific to the culture that you're developing them for. And the US Pointer trial was also very exciting and heartwarming as well.
And then we're launching the trial in Andhra Pradesh and Telangana to begin with, and then the plan is to spread across other states in India.
Okay. Thank you so much for joining us and sharing your wonderful research with us.
Thank you for having me.